Okay. Hello, my name is Corey Thompson. I'm a program analyst at the Drummond Group, and I'll be presenting with my colleague Todd Margot, Director of Product Strategy and Business Development today. Thank you for the opportunity to share our work to date on developing a pediatric electronic health record testing and certification program in the United States. As noted on the slide, Drs. Yu and Lehman are affiliated to universities. This disclaimer states that this presentation is a discussion only and is not a commitment of the program offering. In this presentation, we'll provide an overview of the program development, including an introduction, highlighting the background, problem statement, and methodology. These are followed by our current results, including program development details such as process, examples, and expected benefits. And we finish with the conclusion and next steps. So introduction to start, the Drummond Group is an authorized certification body and an accredited test lab within the U.S. Department of Health and Human Services, Office of the National Coordinator Health IT Certification Program, or ONC for short. Drummond specializes in working with health IT developers to test and or certify their software for use by healthcare providers in regulatory programs. We also offer comprehensive compliance, security, risk management, surveillance, and education services. As noted in the graphic, we have over 20 years experience and have conducted thousands of customer engagements. For background, it is generally recognized that although pediatric-focused EHRs exist, most EHRs have not been developed with children as a focus. It is also recognized that the ONC Certified Health IT program has not focused on use cases for children. This has raised concerns by stakeholders such as pediatricians, independent research firms, and health informatics specialists. The concern is that the use of EHR technology that does not address the unique needs of children may in fact cause more harm than good. The ONC's 21st Century Cures Act final rule is an initial attempt to address this. The final rule recommends voluntary certification of pediatric EHR functionality, but did not specify a mandated testing and certification program. As part of the rule, the ONC also published 10 recommendations for pediatric EHR functionality. So the problem is that a vendor that wants to support ONC's 10 recommendations for pediatric EHRs has no independent way of validating that they are doing the right thing. For example, 2 vendors claiming to meet the 10 recommendations may have differing views on what the functionality should be. This in turn means that buyers or evaluators of EHR software have no independent assurance that a vendor is complying with the ONC recommendations. Second, it recognized that the ONC 10 recommendations are only a subset of a larger set of pediatric EHR functionalities that are needed. So moving on to method. To address these gaps, Drummond is proposing 2 approaches. First, we are seeking to develop a voluntary pediatric EHR testing and certification program, administered and sponsored by Drummond. Second, we want to cover a broad set of pediatric EHR requirements, which would include and expand beyond the ONC 10 recommendations. Vendors who complete the testing program would receive a certification seal from Drummond, which they can then use to help differentiate their products in the market, providing an independent assurance that they have implemented the tested criteria. We commenced the program at the end of 2019. Because Drummond is not staffed with healthcare practitioners in general, nor pediatricians in particular, we needed to recruit an expert advisory panel who could advise on developing and prioritizing the test criteria for the program. The advisory panel consisted of pediatricians, EHR vendors, and industry informatics experts who participated on a volunteer basis. These individuals were also co-authors of the references listed in this presentation. This advisory panel has been critical to program development. The program would never have gotten off the ground without the dedication of these folks. While COVID-19 impacted the participation level of the advisory panel, a core group has remained on the project for almost 2 years now. Another key resource is the published 2015 Agency for Healthcare Research and Quality, or AHRQ, Children's EHR Format Enhancement Report. The report offers a prioritized list of 47 requirements for a pediatric EHR. The American Academy of Pediatrics worked with AHRQ to select these 47 requirements from a list of several hundred. These 47 requirements also include the ONC 10 recommendations. Another key factor has been the formal standards work towards child-specific functionality in electronic health records. In 2008, the HL7 Child Health Work Group's work led to the publication of the EHR Child Health Functional Profile Release 1. This body of work was leveraged for Certification Commission for Health Information Technology Pediatric Certification Pathway. At least 50 EHR vendors were certified, and the work was promoted for inclusion in the US Meaningful Use certification language. Leveraging the 2008 standard, ARC published the 2015 Children's EHR report that identifies 47 essential functionalities. This report was recommended as a pediatric standard for the Centers for Medicare and Medicaid Services related EMR adoption efforts. In 2019, ONC leveraged the ARC report to identify the 10 recommendations and state the need for a voluntary pediatric EHR testing and certification program. In 2019, as mentioned, Drummond started developing this program. Most recently, work on an HL7 Pediatric Care Health IT Functional Profile Release 1, which took inspiration from the previous and current efforts as shown in the slide and gathered input from the larger pediatric and HL7 community through its summer ballot period. This functional profile is anticipated for publication in early 2022. And with that, I'll hand the presentation over to my colleague Todd to present and discuss our current results.
The basic process we've followed for program development so far has been to conduct monthly virtual meetings with our advisory panel, where we first studied the Children's EHR Format Enhancement Report in detail. In these meetings, we painstakingly analyzed the requirement statements and explanatory notes in the report. We reassessed the 47 requirements for continued validity, and where necessary, reformulated or updated them. We also ended up creating new requirements from the discussion of the existing ones, which is reasonable to expect given that the report is now about 6 years old. From this analysis, we created what we called findings reports for various topics associated with the 47 requirements. For those of you not familiar with the Children's EHR Format Enhancement Report, the 47 requirements are associated with various topics like newborn screening, well-child preventative care, special needs, growth charts, and so on. So our findings reports generally aligned with these topics and also documented the discussions that occurred in our meetings. The next artifact from this was to create a set of consolidated conformance criteria statements, which basically are statements in the form of the system shall do X or the system shall be able to do X in the case of baseline requirements. And in the case of advanced requirements, they would be formulated as the system should do X or should be able to do X. We also identified for each requirement whether it was something uniquely needed for an inpatient setting versus ambulatory, or whether it applied to both settings. Most requirements were assessed as being needed for both settings, even though there's often a variation involved. Next slide, please. An example of the topics being covered for our pediatrics EHR program is shown on this slide. This is derived from the primary topics in the Children's EHR Format Enhancement Report. As a current status, we have about 13 topics. We may be doing some further consolidation. The intent of these topics is that multiple conformance criteria fall under a topic, so it's a way of grouping functionality important to pediatricians into themes. And it's also a way we're going to streamline testing so that multiple requirements can be tested as a package under a particular topic. Each conformance criteria is associated with one and only one topic, so you can think of these labels as primary topics. Next slide, please. Here are some examples of actual conformance criteria statements, and these two are baseline requirements. And we know this because the HL7 conformance verb shall is used. In the first example, we were looking at the area of newborn screening follow-up, and the idea is that the EHR would be able to capture the fact that a patient has at least one abnormal screening result, and we want the pediatrician to act on that promptly, so it gets put on the problem list. We also consider that the EHR might capture information about a specific abnormal screen and might be able to inform the practitioner of the specifics of this if applicable. In the second example, we are in the realm of basic analytics to identify potential disparities in preventative care across a patient population. In this case, a 3-year-old Hispanic patient or a group of 3-year-old Hispanic patients who are overdue for their well child visits. Next slide, please. This next example actually builds off the previous one. It describes additional functionality in the area of continuous process improvement to help a practice with well child visit compliance performance. This is an example of something that our advisory panel suggested as helping to move the industry forward. Thus, it's formulated with the should verb. Next slide, please. Overall, a summary of our current status is that we have completed a preliminary consolidated list of conformance criteria across a broad range of topics. There are about 170 conformance criteria statements across 13 topics. As I stated before, some additional streamlining and consolidation will most likely take place. From this, we will move on to the definition of test scenarios and test scripts, and then pilot testing. Next slide, please. One interesting observation from our work is that there are actually very few pediatric specific or pediatric unique requirements. Most happen to be variations on functionality that is already supported in perhaps a more generic sense, or at least a partial sense in a general purpose EHR. There are some exceptions, of course. However, this is overall a desirable insight because it implies that better pediatric support in EHRs will not require, in most cases, fundamental new subsystems or module creation, but rather extensions of already existing features. And this should ease the business case for EHR vendors looking to improve pediatric support, but not necessarily viewing pediatrics as their primary market. And for some vendors, it may help them make the business case decision for entering the pediatrics EHR segment for the first time. A second observation is that given Drummond's longtime experience in O&C health IT testing and certification, coupled with our work on this program, we think we have the potential to contribute new methodologic knowledge to develop and implement formal testing and certification programs for EHR functionality that is generalizable to other clinical domains, such as mental health, oncology, or dentistry, or senior care. There are many. So note that complementary publications are underway. Next slide, please. To summarize a few limitations of our work so far, the results we are reporting are preliminary and await the completion of our program development as well as our experience with our program in the actual health IT marketplace. We expect our program to evolve over time as health IT technology in general evolves and pediatrics EHR functionality also evolves. We also note that there is a paucity of literature on developing EHR testing programs, so Drummond has had to rely on its experience with O&C testing, our advisory panel input, and our participation in the new HL7 pediatrics functional profile effort. Next slide, please. We're expecting several benefits to the healthcare ecosystem from an updated pediatrics EHR testing and certification program. First and foremost is improvements in EHRs to better support care for children. And a lot of this is focused on the basics, such as safe, effective, and prompt attention to newborn screening follow-up, and getting kids to make more frequent well child visits throughout their childhood years. Another expected benefit is additional assurance to practitioners that products they are licensing or evaluating have been independently looked at, and we're not just relying on vendor claims. Third, we want to give market recognition to the leaders in pediatrics EHR. This will help drive the overall market forward. And we'll do this by including these an advanced track of testing, and only some vendors will be able to complete that. Fourth, we think this program can also improve pediatrics EHR functionality in general purpose EHRs. And this will, in a sense, raise all boats for pediatric care. Next slide, please. The next major steps are to develop test scenarios, and test scenarios describe realistic clinical situations and workflows in which we can test a related set of conformance criteria. This will make testing efficient. We need to make sure that conformance criteria are fully exercised, but we want to minimize duplicate function testing. We think there will be about 10 to 20 test scenarios, but it's a little too early to tell yet. We'll then move on to develop test scripts, which describe the actual functions that an EHR product will be expected to demonstrate in a certain sequence to show it conforms to specific criteria based on a test scenario and using test data and so on. We will also be creating additional internal documentation for the Drummond personnel who will be administering the test. These folks are known as test proctors. And the documentation I'm talking about here really supports our internal program quality management. An additional key milestone will be a pilot testing program. We'll then revise the testing procedures as necessary, and then we'll finalize the test scripts. Next slide, please. Here's a list of references that were used to support this presentation. Next slide, please. With that, we'll end the presentation, but I'll point out that if you have questions about the program, please feel free to reach out to me through the email address above. And we want to thank you for your time.